Thank you for joining today's Health Education and Learning Program webinar, Data and How to Use It in Population Health Transition to Value. The National Rural Health Resource Center is a nonprofit organization dedicated to sustaining and improving healthcare in rural communities. We are the nation's leading technical assistance and knowledge center in rural health, and we focus on 5 core areas. The center is committed to DEI and anti-racism, and we create an environment that reflects the communities that we live and serve.
So hello again. I presented a few weeks ago on our first of 3 in our series of moving from volume to value. So again, hello, I'm Connie. It's good to see y'all again. Before I start going into my presentation today, I just want to ask you guys to sit back and be able to absorb all the information that I'm going to be giving to you today and be able to build those bridges between those little nuggets, those little islands of information that you guys have all acquired over the past years about population health and about moving the needle in healthcare from volume to value. There's so many different parts of it, and we talk about them in different trees, but really we need to sit back and see the forest. And so as I'm giving you this little nugget of information, this little 4 or 5 trees in that forest today, please do your best to try to bring in to view the rest of the forest. And at the end, we're going to have time for question and answer period. Please feel free to ask questions about how the information I provide today really fits the larger picture as a whole. I want to be able to not just give you a little slice of the pie, but see how that whole pie is going to be able to serve us in the future. So without further ado, I just want to give you all a big old reminder that documentation is the cornerstone of the business. And so throughout any portion of clinical healthcare, documentation is a number 2 priority. Number 1 is the actual patient care. Number 2 has to be that documentation, because if it isn't documented, it didn't happen. Yes, what goes on in the patient room with that face-to-face encounter with the provider is super important, but only the people in that room were there and know what happened unless the documentation can be good enough to really reflect what that was, what that interaction was like. So if there's only one thing that y'all remember from today, please let it be our lesson from last time. Documentation is the cornerstone of the business. Okay, so today, when I say data, that can be a very overwhelming word, but truly, data is everywhere. It is everything. It's anything you can count. It's anything that you can quantify. It just is. And it's not that scary if you learn to look at it through a different lens. So we don't need any fancy programs. We don't need any fancy data analytic programs like SPSS or Tableau or any mapping software. You already have what you need, and that is your either electronic health record, your electronic medical record. There's still some practices out there that utilize paper charts. It's going to be a little more difficult for you, but if you're willing to thumb through everything, you already have what you need. So when I say data and I say patient information, it can be a little confusing because quality metrics, and when we say quality in healthcare, it's different than in day-to-day interactions. day-to-day interactions is kind of like, well, how good is something? But in healthcare, it's more specific, rightfully so. So I have some examples here on the slide with some of the more lower hanging fruit of quality metrics in the medical field. High blood pressure control, preventative screening of tobacco use, childhood immunizations, hemoglobin A1C, so that's for diabetes, documentation of current medications in a medical record. When you guys get the slide deck, all these links are live, and down here in the bottom right corner, I have an additional resource that is for CMS. Although rural health clinics currently don't qualify because they don't have enough patient lives for MIPS, they do have some specific suggestions for small rural practices of how they can start on their journey of quality metrics for their practices. And so please feel free to check out that resource when you're able to get a hold of the slide deck. But I wanted to show you specifically a few of these examples. Now, before I go in and show you like the websites themselves, identifying the lowest hanging fruit is super important, because thinking of what is the standard operating procedure in most primary care outpatient clinics out there. Every patient usually gets their blood pressure taken, their weight recorded at each visit. They're also asked about what medications they're on, what the dosage is, and in most practices, when they're first roomed and they're with that like medical assistant or nurse, they go through and they ask them screening questions like, what's your tobacco use? What is your social history? These links on the screen are just a few of very, very many measures that clinics can choose from. And again, you'll be able to get more information on that bottom right link. But let's go ahead and let me see if I can get out of here real quick and show you some of these quality indicators. So here we have that A1C for diabetes. This is a really awesome resource. So for data in your electronic health record, you should be able to pull a report that shows everybody who has been diagnosed with diabetes. And on this resource, here's the really cool thing. You scroll down and it shows you the actual ICD-10 codes that you can punch into the report creator and be able to pull those specific patient records. And so you'll be able to get a specific list of all the patients that you need to be able to participate in this quality measure. I thought that was amazing. It's basically handing you exactly how to do this, and it's making it a lot more user-friendly than some of the other quality indicators I've seen. But scrolling back up to the top here, sorry, don't mean to make you dizzy. This tells you the instructions for how to actually calculate in the time frame to be able to assess this, the description of the patients that you need for this measure. Here, denominator, numerator at the bottom here, for how to actually calculate this specific measure. It's pretty long here, hang on. Numerator there. Tells you what some of the qualifiers are, have that dementia exclusion medications. And then here, performance met or performance not met. It makes it pretty easy to just go through and see how to calculate, how to do it. Did you meet it or did you not? The rationale for it, which is if you are a provider-based whole health clinic and you need to explain to your board why you are doing this specific measure. This is your justification right here. It tells you specifically like, if it don't make dollars, it don't make sense. So in your justification, you can say that if you are keeping better tabs of your patients that are diagnosed with diabetes, you could potentially be saving, number one, lives, but also a lot of money, and it helps the community as a whole. They have clinical recommendation statements. And then if we scroll down even more on here, I'll show you the thing that I think is pretty cool. They have a flow chart. I'm a huge fan of flow charts. It kind of takes the guesswork out of the equation, and it steps you through what you need to do stepwise and how to do it. And if simple yes and no decisions, and then we'll bring you back if you need to do something else. And it's pretty cool. I like these things. And so again, you'll have these links in the slide deck for you to go ahead and explore. And then I have a little thing up here. On another one, here we go. For controlling high blood pressure. If you think about your Medicare population, who is the like bread and butter of the CMS, RHC programs, a lot of the patient population has high blood pressure, hopefully controlled at this point through medication or other interventions that they work with their primary care provider on. But as part of keeping tabs on those patients, you're able to come to this page, and it will walk you through what you need to do to keep tabs on the actual quality metric of it. And so again, it has that description, it has the instructions here. And if you see here, see if I can move my mouse here. This is only a performance period of 1 year at a time. And so if you think about it, these aren't something that needs to be tracked every single day. This is just a once a year check with a patient's labs. And so it's not that much of a burden to take on, especially if you start small. So pick 3 to 5 of the quality metrics that you think are going to be the lowest hanging fruit for your practice that will apply to a certain subset of your patient load, whether you want to go big or small. And it's just like a one-time check-in, and it's fairly easy. So if you go down on here with the instructions, it also tells you denominator, go down the specific CPT codes, denominator exclusions, your numerator for how to measure, of course. And then if you keep scrolling down, whether or not performance was met, and it gives you clear guidelines. Rationale, again, if you need to explain why you are tracking this specific quality measure. And then keep going down, you will hit your flow chart. Here we go. And so I really like these tools because they've done a great job of making a clinical measure usable and understandable. I'm not clinical whatsoever, but I'm able to understand this tool, and I'm able to go through it, and I could calculate using the denominator and numerator information what patients are controlling their high blood pressure and if this quality measure is being hit or not. So I'll just show you these two and come back here. Again, all of these are live. And so you'll be able to click on each of those if you want more information. Those are the lowest hanging fruit that I could think of, but again, I'm not clinical. So please feel free to go through and see which ones would be best for your clinic and your patient population and your providers and what they feel is most important for your community. So I've talked about the measures and some of the lowest hanging fruit, but how are you going to actually get the data to be able to assess and calculate? So Excel is your friend. It's very daunting when you first open it and it's just blank spreadsheet. And I personally get flashbacks to high school, and I might be aging myself, but like I had a computer class in high school, and I have no idea what to do or how to like start aggregating data. But hopefully it's not as scary as it was back in high school for me. But Excel truly is your friend. So most of us have electronic health records or electronic medical records these days. There are basic reports that you can pull, but also you should have a customer service line where they can tell you how to create specific reports. From what I've heard, if you ask your electronic health record company to create a report for you, that custom report, it could cost you. And so I'm a big fan of free. So what I do is go with what they give me, and whatever it is, the basic information, I have to make sure that there is like identifier, so that patient ID is perfect for it, because you want to be able to make sure to keep tabs on the individual patients and whether or not you're moving the needle on their health. And so with that said, pull whatever basic electronic health record report that you can with the most information that you're going after. So whether it be birth date, diagnosis codes, lab results, social history, so the medication lists, the date of the last, what's the word I'm looking for? Appointment, clinical visit, there we go, clinical visit with the provider. If there was any labs done, just a basic poll of the last information. And if they give that to you in an Excel format, awesome. If not, you can get it in PDF. Here's another thing. With Excel, with all these electronic health records, with even if you're on paper charts and you need to hard enter that data in Excel, Google is also your friend. There's a tutorial out there for anybody and everybody at this point. I personally taught myself statistics with YouTube tutorials. But Google is such an important tool, and there's how-to instructions out there. There are experts that are putting out their knowledge for free. And if you just go and look, you're probably going to be able to find it. So if you are able to pull a report and they give it to you in some sort of spreadsheet or table format, you can literally copy and paste into Excel. If they give you a PDF report, you can have that PDF transformed into usable data into Excel. And so I have a quick version of the directions here. But also, if you click on this YouTube link down here in the right hand, bottom right hand, it is a tutorial showing you every step how to convert a PDF into usable data in Excel. And so please feel free to use that. Again, Google and Excel are your friend. YouTube is probably the best tool that has ever been made. Now, Excel continued. Here are some of the basic functions or equations you can use for analyzing your data in Excel. Again, really amazing YouTube tutorials for how to do each and every one of these. But I'm going to give you some examples of operations you can do and which one of these would apply to it. So, first example, how many of your patients are over a certain age when it is recommended they receive a screening of some type, whether it be for colon cancer or breast cancer or anything really? You can use the filter function, you can do conditional formatting, and the count function. Each and every one of these YouTube tutorials linked here are very user-friendly, very 101 version, and will be able to help you. What is the average age of the patients diagnosed with diabetes? Again, you can use the filter and the average function. How many patients have not yet received their childhood vaccinations? You can filter out for your pediatric patients and then count. How many patients, or pardon me, how many times has a patient diagnosed with diabetes had their A1C tested in the past year? The clinical recommendation is once a quarter, so 4 times a year. You're able to filter for your diabetic patients and do your sum function. Super easy. It sounds complicated, but once you're able to look through some of these tutorials, it's going to be a lot easier than it seems, I promise. So now what? We have all this information of clinical data, how to calculate the quality measure, how to get the Excel and functions and all this like data analysis. What does that really mean for the practice? What does that mean for your clinic and your patient population? So glad you asked. Here we go. So again, data is everywhere that we look. Every patient brings with them a whole truckload of data because everything is measured. Here's how you can make the rubber hit the road. Chronic care management and principal care management are just the low-hanging fruit of possibilities. And so I'm just, for time's sake, I am focusing on these. So in the previous presentation, the slide should look familiar. Here is a live link where you're able to go and see this MLN booklet. And it will give you all the information you need about chronic care and principal care management. Really the only difference between principal care and chronic care is principal care is 1 chronic condition and chronic care is 2 or more. So for time's sake, I'm just going to say chronic care management, CCM. Now, chances are clinics are already doing parts of CCM. Why not formalize it? So you can actually get paid for the work that is already being done. Really, in our path or our journey, I'm kind of making a motion of like busting in like the Kool-Aid man through a door, but we have been on this path for a very long time. It's that call from a patient that's asking, hey, I've started taking this medication, but I forgot what the doctor was saying about when I should be taking it. Or is it okay to take this with food? Or I can't remember when I was supposed to take it. Or a patient missed their the time that they were supposed to come in for their lab draw, or they missed their appointment and somebody from the clinic is following up on it. And so really these programs are just keeping better tabs on your patients. And the whole point is to make them more well, to keep them from slipping through the cracks. And how you're able to measure that is through data. And again, most clinics are already doing this. It's basically just keeping better tabs to prevent bad things from happening and to help good things continue. If you are a patient-centered medical home, you are already operating this way. It's just a giant CCM model. However, as a service line, in addition to your patient-centered medical home certification, for your Medicare patients, you can actually be paid on this chronic care management service line. And so it's definitely something to look into. Using the data from your patients to inform your practice model, and really this is what this is all circles back to, is a practice model. And that model is moving from volume to value. And that whole value is taking care of your patient population. That journey is already happening. And if you formalize it, and hopefully you're seeing a pattern in what I'm saying here, formalizing it will help multiple things. Number one, you'll truly be able to see if a patient's health is improving, or at the very least, is not declining. Also, you see how good you're doing at keeping on top of everything. Patients are happier, staff is happier, money is saved. Most importantly, lives are saved. And it's already happening. We just actually have to recognize it. Now, here I have more resources. These are the standards, but some of the really awesome ones here. So CMS quality measures in the middle here, YouTube tutorials. Excel is fun, is the actual YouTube channel that I learned statistics on. It is from a professor at a university that puts his entire courses up online for free for everybody. Like I said, there is a cornucopia of resources out there for everybody. Up here on this top one, we have the CMS Rural Health Clinic Center. They have, this is the one-stop shop for CMS, but also there's an opportunity to go through and look at cost reports, which can inform patient care. I'm not going to go into that right now, but if you're advanced, you can go ahead and take a look at those. But this is more of a 101. Here we have that MLM booklet. This gives you the overarching snapshot of the chronic care management program. Here we have the rural providers and suppliers billing. This is a really good resource. Let me see here, if I have some time to go through. Here we go. Here's some other resources. Let me see if I can pull up. Let me see here. here we go. So when you click this link, it'll bring you to the MLM booklet. And what this booklet is a snapshot of the program. Really awesome program here. Go down, and it's only 15 pages. It gives you a comprehensive look. It will tell you what's changed from the last publication. Here is the main thing I want you to see. So it will tell you what you need to do, how you need to do it. It tells you about copay information, not request, permission from the patients, what the requirements are for CCM. So chronic care management service lines are allowed to be done at rural health clinics, and they are paid outside, see right here, outside of the face-to-face patient visit. And so your all-inclusive rate does not apply here. This is a separate service line from that. And so it's not going to be in kind. It's not going to be rolled up into it. It's completely separate. Here are the providers that are able to do it. And here's the information I wanted to show, the specific CPT codes to be able to bill for this service. And it has the time requirements that you need to be able to qualify for each of these services, patient eligibility, supervision, hypertension, diabetes, cardiovascular disease, arthritis. Think of how many of our rural patients are diagnosed with some of these conditions. This could be a huge step forward for your population health, volume to value journey, just by instituting this program alone and keeping tabs on the data that is associated with it. So hopefully you guys have time to look through, and if you have any questions after the fact, my contact information is on the very last slide of the slide deck. Please feel free to reach out and ask me any questions you have. Always here for you. Also, your state office of rural health in your individual states can help. Let me get down here. There we go. This gives you really excellent information about what you're allowed to bill for at the same time, what you're not allowed to bill for at the same time. CMS does a really excellent job at succinctly giving you the information you need to be able to run these programs. And here's the principal care management. Again, very similar to chronic care, just how many diagnoses they have. And so with that, I will come back over here, bring up my contact information. Eventually, there we go. Does anyone have any questions?
Oh, there's a great comment in the chat box, Tawny. It says, great and thorough presentation. I deeply appreciate you and the time and consideration that you applied to this presentation. I would agree with that and echo what Elva shared.
Thank you very much for that. I appreciate that. Thank you. And again, please feel free to reach out to me if you have any questions. If you're having any trouble finding more resources or learning Excel or even with your EHRs, I'm not an expert in it, but what I am an expert is Googling and YouTubing. So where there's a will, there's a way, and I can find a tutorial probably. So if there's any way I can help y'all, please just let me know. We are very grateful at No Sword to have the opportunity to be able to present for you guys. Thank you so much to Kiona and RHPTP for allowing us to be able to present for you.
Thank you. As always, we encourage you to reach out to us with RIPT with any TA questions that you have. Thank you again for your participation and have a great rest of your day.